DoortoBalloon Time is the time that the patient arrives here to the hospital in the emergency room to the time that the patient's brought down to the cardiac cath lab for PCI interventioning, opening up a blockage to the heart. So national standard for DoortoBalloon Time is 90 minutes. Here at Henry Ford Allegiance Health, our DoortoBalloon Time is actually averaging at 64 minutes, so we're significantly ahead of the national average for DoortoBalloon Time.
DoortoBalloon Time is so crucial and important to our facility because the patient only has so much time to revive that blood flow, and we refer to it as Thymus Muscle. So the longer it takes for us to open up a blockage, the more crucial the side effects. It's kind of a trickle-down effect, a domino effect.
So some of the things that we do here to meet those standards for DoortoBalloon Time is early notification of physicians, cath lab staff, our cardiac team here to let us know that there's a patient who possibly needs to have, an emergent PCI. One of the things that is early activation for EMS in the field. So if they're doing an EKG on a patient out in the field that they're going to get that has chest pain, they're notifying the ER ahead of time in advance saying that yes, this person has ST elevation on their EKG. That allows for the emergency room to set off a house-wide page for everyone that's involved to allow your staff here to know that we need to come in to help that patient.
We get to carry these pagers they're pretty much our life. We carry them around everywhere we go, and it's kind of like being on a timer 24/7 because once your pager goes off, you only have 30 minutes to get here.
So as a group, once we get here, we do try and make a little game plan with each other. So as a team, we're always ready. We always talk about it before we get things done. So, even though I have my individual role as being the scrub at the table, we still have a role all together as one.
One of the other things that happens in the emergency room is when the patient arrives to the ER, they're getting EKGs within 10 minutes of arrival when a patient has a chief complaint of chest pain. The standard here at Henry Ford Allegiance Health is we're meeting about 7 minutes on our EKGs, so we're beating that 10-minute time. The sooner that we're able to get a positive EKG to know that we have ST elevation, MI, we're able to get that patient down here to the cath lab sooner and restore blood flow to the heart, which is saving muscle. So it's very important.